In this video, we'll be going through the top 5 tips of things to consider when preparing yourself for a medical school application. Obviously, the earlier you start thinking about this, the better. And most people, when thinking about applying to medical school, do so a few years before they actually have the deadline to do so. And so you've got plenty of time then to start thinking about how to optimize your application to make the best chance of being able to get into medical school, which even in this day and age is still very competitive, even with the expanding number of places that are available. So in order to have a successful application first time round, it's really worth thinking about each of these 5 things as early as possible so that you can start to approach each of these and tick them off so that you can make your application as well-rounded and as effective as possible. I cannot emphasize enough how important it is to get work experience. Now, medicine itself is a wide-ranging thing. There are multiple different specialities within general medicine, within surgery, within intensive care, and in other medical specialties such as obstetrics and gynecology, intensive care, anesthesiology, and so on. So really is worth getting a wide breadth of experience, because there really is as part of medicine for every single personality type. It also gives you a good idea of what it means to be a doctor. As much as we as admissions tutors look to see what work experience people had, to see whether they understand what it involves, I think it's just as important for you to see what it involves to know whether it's something that you want to do. I don't think anyone enters medicine thinking that it's going to be easy. But actually, it's not as hard as many people make it out to be. But part of the reason why a lot of people don't find it that difficult when they're doing the job is because they love it. And in order to know whether you're going to love it or not, you must get that work experience. It can sometimes be difficult to arrange this, and it can sometimes take a few years to arrange it, so the earlier you try to do it, the better. And what you will often find is that most doctors are so keen to try and get people in and to give them the experience of being in a hospital or being in a GP practice or being in surgery or any of the other specialities. Because we want to promote and try to get the next generation of doctors to come through. If you're ever in doubt, then contact your school or contact the local hospital, and you will often be put into contact with someone who'll be able to help you. We'll go through a number of videos where we'll try to talk to you about how to get the most out of your work experience. And for many people, they just turn up to their work experience as a tick box exercise for their personal statement. But you've got to be a lot more focused in what you're doing in order to be able to get the most out of it, not just for yourself, to understand what it means to be a doctor, but also to get the gold experiences that can really make your personal statement stand out from every other one. So look out for those videos that'll be coming on the channel a little later. It's always important to do a bit of research, and you should really have a look at and see what it is actually involved in studying medicine. Medical curricula and medical schools themselves have changed a lot over the last 5 to 10 years. The days of didactic teaching and learning, where you sat in lecture theatres for the first couple of years of your medical school training, are gone. It's a lot more problem-based learning, and there's a lot more exposure to clinical work early on. So it's important to understand exactly what studying medicine's all about. It's also really important to understand what the trials and tribulations of medical students are. Medicine is a very unique degree. It's a vocational degree. You're training for a job in and of itself, but it's a job that requires an incredible amount of knowledge in order to be able to do it effectively. As such, being able to speak to medical students is really important. So university open days are vital to being able to talk to these medical students at an early stage. Also, if you're in a school that has doctors qualified, or if you've got students that have gone into medical school, ask your careers department and ask your teachers whether they've still got their contact details. Find out what it's like, because you have to remember that you're committing yourself to 5 to 6 years of being in medical school, and if you don't enjoy it, it really can be a long slog. But if you do enjoy it, if it is actually what you want to do and what you're suited to, it can be the best 5 or 6 years of your life. So try and get that experience by speaking to previous medical students, talking to doctors and finding out how their experience of medical school was, going to open days if you can find them, and there are a number of little courses that are now being run by medical students to try and give a bit of a flavour for people of what medical school is like. The TeachMe Pre-Med channel itself is actually quite a good introduction into what problem-based medical learning is like, and some of the lectures that we give are exactly that. It's exactly how you would be learning in medical school, and if you respond well to that, then you may well find medicine an interesting and stimulating degree to study. It's also really important to have a look at the different medical schools that are available. Different medical schools will focus on different things. Now, the days of each medical school being vastly different from each other are over, and a lot of them have, generally speaking, the same sort of way in which they teach students. A lot of it has moved over to what we call problem-based learning. This is where we give people a clinical problem, like a clinical disease, and then we talk about the science that you need to be able to understand that disease, so linking it all together. So separate to how we used to learn, where we had separate biochemistry lessons, separate anatomy lessons, separate physiology lessons. Now we bring it all together and mesh it around a particular case. There are still some universities that have each of the different specialities separated out, and some people like that. I'll be perfectly honest with you, it's mostly found that whichever medical school you end up with, you will enjoy it, you will learn what you need to learn, and all of these nuances pretty much even out over the course for a few years. But when you go to the open days, it's really important to talk to the medical students, because they will tell you some of the pros and cons of having the didactic separated specialities like biochemistry, physiology, anatomy and so on, compared to having the problem-based learning where everything is amalgamated into one. And they definitely do have their pros and cons. One of the most important things to really try and show in medicine is that you have a desire to help people. Because otherwise, if it's just purely about the science, then you can very easily apply for a medical sciences degree, or a physiology degree, or an anatomy degree, or any of the other specific science degrees. What stands medicine apart from those is the clinical contact and the clinical context of what you're learning. So, if you don't have that desire to want to help people, it really begs the question, why are you doing medicine as opposed to actually learning the sciences themselves? And part of it has to be that you must make sure that your personality is one that can work with people. So, volunteering in your local charity, volunteering to do fundraising activities within the school or outside of the school, these are all really important. But aside from that, you can also show your desire to help people by teaching those who are younger than you, by running clubs and trying to foster more interest in particular areas. A great example is of just running the Medical Dental Society. By doing so, trying to inspire younger school children into the joys of medicine. All of these things are really important, and it's worth thinking about it early. And lots of people can say that they enjoy helping people, but it's very different to be able to actually give concrete examples of the time that you've spent, for example, in a hospice, or working for a charity, or fundraising, or any of the other things that involve actually having person-to-person contact. And the earlier you do that, the more commitment it shows. Anyone can do 6 months or a year of volunteering, but those people who have spent 3 or 4 years doing these things, not only do you find that those people are more engaged in what they're doing and more interested in what they're doing, but it also shows a genuine desire to want to do it because it's part of your personality, as opposed to just a tick box for part of your personal statement. I've put this tip as the 5th tip, the last tip, really because everyone puts so much emphasis into being academically bright, having lots of qualifications in order to be able to get into medical school. Now, of course, it is really important to have the scientific mindset to be able to learn lots of information and to be able to put together abstract concepts to bring about a clinical care for a patient. But actually, academic prowess is the one thing that you can develop and learn. You can work hard and study. Part of it, though, is not just about being able to be really good at your sciences. Part of academic prowess is showing that you're able to read around subjects, that you've got a broad range of skills. And so some people get really focused on just being able to be good at the sciences. But arguably a lot of admissions tutors really like those students who do the other non-typical science subjects, things such as art, English, history, geography, all these other topics, where again you have to learn a huge amount of information, assimilate it and apply it. And that's exactly what medicine is all about. There is no point in being able to learn lots of abstract anatomy if you can't put it together and work out when someone needs surgery, which bits you need to cut out, which bits are linked to which other areas, and being able to put it into the context of a clinical case. So, work hard, make sure you get the good grades, but also do the subjects that you enjoy and that you actually are passionate about, because they're the ones that you're naturally going to excel at. Don't be too worried if you've only got a few science subjects and the others are non-science. As long as you've got the ones that that specific university wants, and there are certain mandatory ones such as chemistry or biology, of course you have to do those, but the other subjects don't necessarily have to be science-based. It's also important to try and think a little bit outside of the box. Everybody will have A-levels or IB qualifications, but it's worth thinking about what else you can do. There are certain additional studies that you can do, additional diplomas that you can get. For example, there are the STEP papers to show that advanced level of knowledge be above and beyond what is in your academic curriculum. You can do things like the Olympiads. There's a biology Olympiad, a chemistry Olympiad. You can write essays and get them published in newspapers or for certain student-targeted prizes. It's really important to look on the internet and try to find these things and to be able to develop those skills. In later videos, we'll go through some of the other off-piece things that we can do to try and show your academic prowess and highlight things like the biology Olympiad and highlight things like STEP papers and so on for you. But it's really worth thinking about how you can show that you're above and beyond the other applicants that we have, because we just get so many applicants coming in and a lot of them are super bright. So setting yourself apart from those is really important. I cannot emphasize enough that you should start early. The earlier you start, the more commitment it shows to whichever thing that you're doing. For example, volunteering or getting additional qualifications. But it also makes you start to think that a little bit earlier about whether it's the right career for you. And so by doing that work experience a little bit earlier, by talking to the medical students that are in medical school or have recently come out of medical school, you get an idea of what you're signing yourself up for the next 5 or 6 years after you come out of school. Make sure that it is the right choice for you. As important as it is to get all the different bits covered for your personal statement for your application to medical school, don't lose sight of the actual really important reason for doing many of these things, like work experience. It's so that you can work out whether it's the right career for you. Medicine is a vocation, and it's an apprenticeship. From the moment that you start medical school, you are going to be starting your journey towards being a doctor. If being a doctor is not the right thing for you, if it doesn't suit you appropriately, it is going to be a long and hard slog through medical school and then for the rest of your career afterwards. I have to say, however, that medicine is such a diverse job. It's got so many different specialities, so many things that are tailored towards particular types of people, that pretty much anyone can find their niche within medicine. And that's part of the importance of talking to people and trying to research as much as possible about the profession, because you will find the right home for you if you talk to enough people and really have a look at what you enjoy in and of yourself. So like I mentioned, for each of these tips, we're going to go into an incredible amount of detail in subsequent videos. So please check out the rest of the channel, as there'll be lots of these videos coming up, and they'll all be tailored specifically to each of these different tips to give you real practical advice on how to make yourself prepared for these medical school applications, and not just prepared for them, but to make them stand out beyond the other people who have applied.